really isn't as scary as people make it sound. Pressure has to go somewhere front and connects into that linea alba. And then a little bit of a separation below. Hello and welcome back to my channel. If this is your first time here, my name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist. On this page, we talk all things perinatal, whether that be preconception, pregnancy, postpartum, and health and wellness. So if any of those topics are of interest to you, make sure you subscribe and join my online community. This morning, I'm drinking a Cinnabun flavored protein iced coffee. It is so good, you guys. It is so good. I've posted some videos on this before and how to make this, but I will put the link for it below if you want to try this protein powder. It's so good. As you saw from the thumbnail and the title of the video, today we are talking all things diastasis. Diastasis recti, diastasis rectus abdominis, diastasis, DRA. Everybody calls it something different and pronounces it a little bit differently, but it all just means the same thing. Diastasis is a big scary word that people love to toss out there when they are talking to you about pregnancy, postpartum, rehab, and exercise, and all those things. I'm serious. How many times have you seen the title of the video as diastasis safe exercises or get rid of your diastasis? They're everywhere. Today I want to go through in detail what a diastasis is, why it happens, and why it really isn't as scary as people make it sound. I'm going to debunk some myths and show you how to check yourself for one as well. Now, this is a very, very full video. I'm going to be giving you a ton of information in this video in regards to many different things surrounding the topic of diastasis. I hope you stick around for the whole thing and that you learn as many things as possible. However, if there are certain parts of this video you are more interested in watching, I've put the timestamps below, so please navigate to the section that is the section that you're looking for. Let's start off with what a diastasis is and why it happens. And I think in order to do that, I need to give you a little bit of an anatomy lesson so that you can fully understand the different layers of the muscles in the abdomen. There's going to be pictures that are put up here, so look over here so you can see sort of what I'm talking about. Right down the center of our abdomen, from our ribs or our xiphoid process right down to our pubic bone, we have this strip of connective tissue called the linea alba. The linea alba is essentially just this piece of connective tissue that gives each side of the abdomen something to attach to in the center. This area ends up being an area of weakness because it does not have any contractile tissue. It's essentially like ligaments that are up the center of your abdomen. So remember linea alba, we're going to talk about that one again later. So our deepest core muscle is called our transverse abdominis. It runs horizontally from our spine all the way around to the front and connects into that linea alba. But you can see in this picture that there's a lot more white in the center of the abdomen. This is called an aponeurosis. It is also essentially just connective tissue that gives something for the muscle to attach to. It is not contractile tissue. However, when the transverse abdominis activates, it does put tension on that area. On top of the transverse abdominis, we have our internal obliques. The internal obliques, they run diagonally from our pelvis up to the center of our abdomen and connect into that aponeurosis. On top of the internal obliques, we have our rectus abdominis. Now, this is the six-pack muscle. I'm sure everyone has heard about this one. It runs vertically up and down. It has many different sections. Fun fact for you, actually, the amount of sections that your rectus abdominis has is actually not something that you can control or change. It's something that you're born with. And I don't know if that is because of genetics or whatever it may be, but some people have 4, some people have 8, some people have 10, but you can't change it. And then our most superficial muscle that's on top of all of those ones is our external obliques. Now, it runs diagonally from our ribs down to our pelvis in the opposite way from our internal obliques. So they kind of line up like this. So I kind of flew through that, but I did want to give you just a little bit of a background of information so that you can sort of picture, so you can sort of picture what these muscles look like when I'm talking about them, and that so you can kind of see there really is no muscle belly down the center of our abdomen. That linea alba, that strip of tissue, is there always and there's nothing that actually overlaps it. Now, what is a diastasis and why does it happen? So we talked about that strip of tissue down the center. I want you to imagine you have a balloon that's deflated. You put 2 lines on it, and that's your rectus abdominis, right? That six-pack muscle that goes up and down, but leave a space between them. As you blow the balloon up, those lines are going to separate from each other because the pressure inside that container or inside the balloon has increased, which forces those muscles to separate from each other. So a diastasis happens when pressure inside the abdomen increases, and this doesn't just happen during pregnancy. This can happen with obesity and lifting really heavy weights. This can happen in many different populations. When pressure increases inside the abdomen, that pressure has to go somewhere. It typically goes one of 2 places. It can go straight down into your pelvic floor, which is when a lot of people will experience things like prolapse. We won't dive into that today. That is a whole separate topic. So it can go straight down into your pelvic floor, or it can go straight out your abdomen on that weak spot or that linea alba that doesn't have any contractile tissue. So realistically, there's nothing preventing the linea alba from widening. It just ends up stretching along with your belly and as your baby grows. So a diastasis, by definition, is that space that's created in between the rectus abdominis muscles while your baby grows and pressure is placed outwards into that linea alba. This happens in 100% of pregnancies to some degree. 100%. This is an unavoidable thing that happens, and it is 1000% normal for this to happen. A diastasis is completely normal, and it's absolutely nothing to be afraid of. For most women postpartum, this gap will close on its own beginning at 1 week to 8 weeks postpartum. So typically it would just slowly close on its own and you wouldn't have to do anything about it, and you shouldn't be worried about it. But what if it doesn't close? Before we talk about anything else, we need to talk about risk factors. For every condition, dysfunction, and disease, there are risk factors that are associated with them that may outline reasons as to why you experience the symptoms that you do or the severity of the symptoms that you're experiencing. In discussing this with you today, I have taken many pieces of research that I have found and that are evidence-based, and I'm kind of taking bits and pieces from some of these pieces of research. All of those are going to be listed below. So if you'd like to take a look at any of those research papers, please feel free to do so. I am taking some of these bits of information and just really simplifying them so that we can get through as much as possible today. There is obviously a lot more to discuss on this topic, but I didn't want to be here all day. I mean, I'd love to be here all day and chat with you guys, but I don't think y'all have the time for that. In this study, it lists multiple different risk factors. The first one is pregnancy, and not even just one pregnancy, multiple pregnancies. So those who experience multiple pregnancies have a higher prevalence or a higher possibility of having a diastasis. And this can also influence the size of the diastasis as well and how easily it goes back to normal. Age is hypothesized to be a risk factor. I don't think this has been verified, but there are multiple studies that kind of show that age could be related, but also along with age, you get pregnancies kind of congruently at the same time. So it's hard to sort of differentiate the two from each other. A higher BMI, or those with more adipose tissue in their abdomen, are at risk as well. Diabetes is a risk factor because it can cause a decrease in muscle mass and function. And smoking is a risk factor because it actually causes weakness of our connective tissues. What if the gap doesn't close? I know this is the question, right? This is what everybody wants to know, is what happens if the gap doesn't close and how can I make it close? Here's where the research is a little bit confusing and it isn't really clear. There's multiple studies that show that transverse abdominis and core muscle training doesn't actually correlate with a decrease in that space between the two muscle bellies of our rectus abdominis. On the flip side, this study and a few more studies that I'll link below have actually said that it may be appropriate and effective to take part in core exercises to decrease that diastasis. So the research isn't perfectly clear, and I know that that's frustrating because it doesn't really give you a set answer to say do this, 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 and this, and it will close your diastasis. We don't actually have a specific exercise or a specific muscle that we can train that will close the gap. Going right back to our anatomy, that is just not how our body was designed, and there is not a muscle that does that. What we do have is all these muscles that connect into that aponeurosis, that white space that is attached to the linea alba. This means we can't actually contract any of our muscles to close that gap. They all bud up against the linea alba, but they don't actually cross it. So there's no muscle going across it that can activate it and keep it closed. What can we do instead? So what we can do instead is we can activate our core muscles that attach to that aponeurosis, and they can actually cause tension to be placed on that aponeurosis, which essentially creates tension underneath that diastasis and keeps that whole area nice and stable. As a clinician, this is what I'm worried about. I'm worried about, can you activate your abdominal muscles to create tension across that space? I don't care how deep it is. I don't care how wide it is. There are plenty of people that live with nice, thick, wide gaps, and they live a perfectly healthy, stable, strong, weightlifting life. So I'm not worried about how big it is. I'm worried about, can you control tension across that space by activating those muscles, more specifically transverse abdominis, because it seems to be that perfectly horizontal muscle. Can you activate those muscles and create tension across that space, which also creates stability of the abdominals? Okay, now I'm going to show you how you can check yourself for a diastasis. The best way to do this is to go to a practitioner. It's always better to have someone else check you because you're more relaxed. It's easier for them to, they have a different angle that they're able to check things. It just ends up being a lot easier. However, if you do not have the availability or the financial ability, this way you'll be able to check yourself so that you know, do you have one, how big is it, and yada yada. Okay, give me 1 second. I'm gonna readjust and then I'll be right back. You want to be lying down for this, so I'm just gonna lie down on the couch. It's probably easiest to show you. So you're gonna pull your shirt up to about your bra line, pants down below your belly button. So I like to start up at our xiphoid process, or right where our ribs kind of connect to each other. You want to kind of take 2 fingers and you're going to kind of go along this line, along midline, and you're going to kind of rub back and forth just like this a little bit. So we're going to go all the way down. Now I can feel my linea alba. I can feel a little, kind of like a lip almost in the center of my abdomen. And then as I get closer to my belly button, I feel a little bit of a separation right here as my rectus abdominis goes around my belly button. And then a little bit of a separation below and all the way down. And you can go right to your pubic bone with this if you'd like to. So that was at rest. Now we need to see what it's like when I have a little bit of increased pressure in my abdomen. So in order to do this, I'm just gonna lift my head just a little bit. And I'm gonna do the same thing. I'm gonna feel the whole way down. And I can feel that line right in between my fingers the whole way down. Now, let's say you feel that you have a diastasis. This is what's important for you to know. So let's say I feel a diastasis here. I need to know how many fingers across it is. I need to know how many knuckles deep it is. So let's say I have one and it's maybe 2 fingers, okay? And you should be able to actually push down into it. And then if you go from side to side, you'll feel the walls of your rectus abdominis. You'll kind of butt up against the 2 walls of it. So then let's say mine is 2 fingers. Now I'm going to see how many knuckles it is. So I'm just going to push straight down. So I'm just going to push straight down, and let's say mine is two knuckles deep. Then I know it's 2 knuckles deep, it's 2 fingers wide, and then we measure how far down it is. Whew, okay. That was a lot of information. And I know I just threw a lot of information at you, so I hope that that all makes sense. Some takeaways from this video. I know I gave you a ton of information today. I hope I gave you lots of things that you need to think about, but I hope you're leaving this video with a pretty good understanding of what a diastasis is and why it happens. I didn't include any exercise recommendations, and I did that for a couple reasons. Number one, 1 million people have already done that. The only thing I'd like to say about that is make sure that your source is credible. Make sure if you are getting information in regards to postpartum rehabilitation, diastasis, pelvic floor, all that good stuff, make sure it's from a credible source and make sure it's from someone who has education in that area. Having a baby and going through rehabilitation is not enough expertise to be able to teach someone else how to go through it. So that's what I would like to say there, is just be very wary of who you get your information from. There are plenty of practitioners out there who have released great exercise programs in regards to diastasis. I can link a couple of them below, some of the more credible ones that I think would be really great for you to either go follow and get your information from. The second reason I didn't include any exercise recommendations is because everyone's treatment needs to be individualized, and for me to say do these 4 exercises, they may not work for everyone. And so I would rather that I actually recommend that you go see a pelvic or perinatal specialized orthopedic therapist, physical therapist, athletic therapist, whoever you have that's close to you. Get assessed, get your individualized rehabilitation program. They will be able to help you a lot more than me just saying do these 4 exercises. And the third reason I didn't is because I'm not there with you and I can't tell whether or not you're doing these exercises properly. I don't want to recommend exercises for you that you may end up hurting yourself. They end up being really uncomfortable. I want to make sure that the exercises you're doing are ones that are the right exercises for you. So that's why I recommend go see a practitioner, get assessed. They will be able to give you a very specific individualized treatment plan. So please, 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 if you have any questions about any of the things that we talked about today, please do not hesitate to send me a message, send me an email, comment below. Let's open up the conversation about diastasis. It does not need to be scary. It does not need to be a big, scary thing. It is a very, very, very normal thing. And I think it's important for people to understand why it happens and the things that you can do about it. And like usual, if you have any recommendations for videos that you'd like to see, if you want me to dive into this topic a little bit deeper, we can always do that. And if you like this video, please give it a thumbs up, share it with your friends, and make sure you subscribe to stick around. I hope you guys have a wonderful day, and I'll talk to you soon.